concerned about heart failure or a weakened heart? Do you know the conditions that can affect it or signs to watch for? In today's video, we'll cover diseases that can lead to heart failure and common symptoms of a weakened heart. Stay tuned to learn how to take better care of your heart and prevent heart failure. Before we begin, like this video and subscribe to our channel. Have you or someone you know face heart issues? Share your thoughts in the comments and tell us where you're watching from. What is weak heart disease? Heart failure occurs when the heart can't pump blood efficiently, preventing the body from getting enough oxygen and nutrients. This can happen if the heart muscle weakens, stiffens, or enlarges. Heart failure affects 6.2 million Americans and can severely limit daily activities, reduce quality of life, and increase treatment costs. About 10% of adults over 70 experience some degree of heart failure. The heart's role is vital in circulating oxygen-rich blood, and when it weakens, the body suffers. Symptoms may be stable at first, often unnoticed until the condition worsens. It's like a car engine running at half capacity. It still works but struggles to perform optimally. Common conditions that weaken your heart. There are several key conditions that can lead to heart failure. Let's take a closer look at these. Number 1. Hypertension or high blood pressure. High blood pressure is one of the leading causes of heart failure. It contributes to over 600,000 deaths annually in the United States. Hypertension puts a constant strain on the heart, which can lead to heart muscle enlarging and weakening. The ideal blood pressure is 120 over 80 millimeters of mercury or lower. However, many people live with blood pressure levels significantly higher without even realizing it, since high blood pressure often has no symptoms. If left untreated, this condition can cause permanent damage to the heart and arteries. Hypertension also accelerates atherosclerosis, the buildup of fatty deposits in the arteries, which can lead to heart attacks. Additionally, uncontrolled high blood pressure can damage the kidneys, which are essential for eliminating toxins and regulating blood pressure. Number 2. Obesity. Obesity is another condition that can put a significant burden on the heart. Carrying excess weight forces the heart to work harder and circulate blood throughout the body. This extra strain can eventually cause the heart to enlarge and weaken, increasing the risk of heart failure. Obesity also increases the risk of other serious health issues, including diabetes and hypertension. Overweight individuals often have higher cholesterol and triglyceride levels, as well as chronic inflammation, which can all contribute to heart disease. Fortunately, obesity can often be managed through a combination of exercise, a balanced diet, and sometimes medical treatment. If necessary, working with a doctor or nutritionist can help create a sustainable plan for weight loss. Number 3. Heart attack or myocardial infarction. Heart attack occurs when blood flow to a part of the heart is blocked, causing damage to the heart muscle. Over time, the damaged tissue is replaced with scar tissue, which doesn't function as well as healthy heart muscle. This damage can weaken the heart and increase the risk of heart failure. The severity of the heart attack, including which artery was affected and how much muscle tissue was damaged, will determine how much the heart is weakened. Number 4. Heart valve diseases. Heart valve diseases can also weaken the heart. These include conditions like valve insufficiency, where the valves doesn't close properly, or stenosis, where the valves don't open fully. Both of these conditions force the heart to work harder to pump blood, which can lead to heart failure. Even mild valve diseases require regular monitoring to determine when intervention is necessary. In some cases, surgery may be needed to repair or replace the valves before the hearts become debilitated. Number 5. Palpitations. Palpitations are feelings of a racing or irregular heartbeat. While they can be sometimes benign, they can also be a sign that the heart is struggling. When the heart becomes weakened, it may try to compensate by working harder, which can cause palpitations. If you experience palpitations frequently, it's essential to seek medical attention to determine the cause and whether it's related to heart failure. Number 6. Diabetes. Diabetes, especially when poorly controlled, is one of the most harmful conditions for the heart. High blood sugar levels can damage heart cells, cause inflammation throughout the body, and contribute to the development of atherosclerosis. People with diabetes also have an increased risk of hypertension, which further damages the heart. Monitoring blood sugar levels, managing diabetes effectively, and seeking regular checkups are all essential for preventing heart damage. If you're diabetic or pre-diabetic, it's important to monitor your glycated hemoglobin levels to ensure that they are within a healthy range. Number 7. Fatigue. Fatigue is one of the earliest signs of a weakened heart, but it's often mistaken for inactivity or just getting older. When the heart is unable to pump blood efficiently, the muscles don't receive enough oxygen and nutrients during physical activities. As a result, you may feel unusually tired after climbing stairs or walking short distances. If you notice persistent fatigue, it is important to consult with your doctor as early intervention can help treat the underlying cause before the condition worsens. Number 8. Shortness of breath or dyspnea. Shortness of breath is a hallmark symptom of heart failure. At first, you may only experience it during intense activities like running or climbing steep hills. However, as heart failure progresses, even light activities can trigger shortness of breath, and it may eventually happen even at rest. This occurs because the heart can no longer pump blood effectively, leading to fluid buildup in the lungs, a condition known as pulmonary congestion. If you experience shortness of breath, especially at rest, it's a critical warning sign that requires immediate medical attention. Number 9. Orthopnea. Orthopnea is difficulty breathing while lying down, a symptom commonly caused by fluid accumulation in the lungs. When the heart is weak, blood backs up in the lungs, which worsens when lying flat. Many people with heart failure find that they need to sleep propped up with several pillows or even sit upright to breathe comfortably. If you notice that you need more pillows to sleep or experience difficulty breathing when lying flat, it's important to consult with your doctor. Number 10. Edema or swelling in the legs. Edema refers to swelling, particularly in the legs and ankles, that worsens as the day progresses. This swelling, known as spitting edema, occurs when the heart is too weak to pump blood effectively, causing fluid to accumulate in the lower extremities. In more severe cases, the swelling can extend to the thighs or even the abdomen. This is a sign of advanced heart failure and requires immediate medical evaluation. Preventing heart failure requires healthy habits like regular exercise, a balanced diet, maintaining a healthy weight, and regular medical checkups. Avoid smoking and excessive alcohol and manage conditions like hypertension or diabetes to reduce heart strain. While heart failure can be reversed, treatments can improve quality of life. Managing blood pressure, cholesterol, and diabetes, along with a healthy diet and regular exercise, are essential. Medications like diuretics, digoxin, and vasodilators can help manage symptoms, and a pacemaker may be needed for rhythm issues. In severe cases, a heart transplant may be necessary. Success depends on both medical care and patient commitment. If you're experiencing signs of a weakened heart or have concerns, share your thoughts in the comments. If you find this video helpful, type yes below. Don't forget to check out our other videos.